I like the little music that plays. We have playing good. Hey, fellas, unmute yourself. How you doing tonight?
Doing good.
Doing well. Happy Monday, guys.
Yes, happy Monday. So for folks who are watching, last month we did a Instagram live that was called "Let's Talk About My Eggplant." So tonight we are going to talk about everybody's or their cake. We're going to talk about that tonight. So I will let everyone introduce themselves, and then we'll turn it over to Josh to kind of moderate us through some questions.
Aaron, why don't you start us off?
Sure. So my name is Dr. Aaron J. Kimball. I am a licensed therapist and a sex therapist. I typically work with couples, members of the LGBT plus community. I also work with teens struggling with sex and sexual trauma, my new niche. So nice to see everybody.
Awesome.
I'm Jeremiah Robinson. I'm a PA, and I work in Atlanta, Georgia at Elysium Primary Care. My specialty is HIV and also just LGBTQ healthcare. Most of my patients are men who identify as gay.
I'm Lamont White. I tell people I'm the gay dating coach because I help guys find love and stay in healthy relationships. I work with gay men everywhere. So, yeah.
Awesome. I'm Dr. Josh Noblet. I'm a licensed marriage and family therapist and certified sex therapist. Also do quite a bit of work with Better Way to Meet in terms of matchmaking, and work mostly with gay men in my practice. And I'm just excited to be here facilitating our second conversation around all things peach and cake and such as.
We're doing peach, we're doing cake, we're doing whole. What are we doing?
We're doing it all. We're doing it all. Okay. Yes, I love to use food analogies. I know we get sent to Instagram jail if we say certain words, so we're using food analogies to talk about what we're talking about here tonight. And what we're going for tonight, as we were last time, is we're going for sexual health and education and awareness. We're going to help folks get out from underneath shame, to walk away with hopefully some new information, and just opening up some conversation for folks to be able to talk about sex and sex positivity, body positivity, etc. So I came up with a few questions for us to kind of get us started. We'd love to encourage folks that are watching to also type in questions. And Lamont, you can explain, I guess, how folks can do that, right?
Yes, you can use the live chat to post a question. Just put a big question mark there so that I can see it, and we'll get to it. And on Instagram, you can put your questions there as well in the chat, and I'll remember to get to them.
Perfect. All right. Well, the first question I think that I'd like to get us started off with is, what cake issues do you encounter the most in your work? Jeremiah, let's start off with you.
I think the most common things are, from a medical standpoint, are just, common things like hemorrhoids, anal fissures are pretty common. And it's kind of important to differentiate between the two, because the treatment is quite different. So, if you're coming into me and you're having certain issues with, pain with the bowel movement, or with, anal intercourse, I need to ask certain questions to figure out, exactly what's going on, and even do an exam in some cases. So I think those are probably the two most common things I see.
Awesome. What about you, Aaron?
Yeah. So I deal with a lot of clients who have some forms of incontinence, specifically if they are the receptive partner. I also deal with, let's be honest, with a lot of partners who are trying to be receptive and they do not have any education, any prep work surrounding it. And they are wanting to get some form of education and support.
Yeah, I probably echo the same thing as Aaron. So as a matchmaker and a dating coach, a lot of guys, they want to be a little bit more sexually versatile in their relationship. And sometimes they may not have been used to being the receptive partner. So they're like, hey, I want to please my partner. What lubes should I use? How do I prepare? Right? Everybody has their own way of preparing. So they want some information on like, what's the best way to make sure that there are no, mistakes or accidents. But I'm like, it's a but, so sometimes stuff happens, but they're really looking for education on like how best to please their partner.
Yeah. I would just add to what everybody said in terms of, folks wanting to expand their sexual menu, in terms of what's on the menu, or helping folks get out from underneath a certain rigidity around, sexual roles. Sometimes, folks say I'm a top and only a top, or I'm only a bottom, or, and just getting folks to, we all like what we like, and there might be some things that we can add to the menu. I'll also say that one of the things that I work on frequently in my practice, I have a theology background, and there's a lot of shame, I think, that some folks have about being the receptive partner, or just about anal sex in general. And so helping folks kind of reframe how they understand that, getting out from underneath what we call the anal taboo, and just helping folks sort of think through that, where some of the shame or anxiety comes, because anxiety inevitably is going to cause a little tightness in there, which inevitably is something that gets in the way of anal pleasure. So those are some of the things that come to mind for me. Yeah. Just as we asked last time, how can you tell in your various the work that you do if the presenting cake issue is a medical issue or more of an anxiety psychological issue? What are some of the things that kind of stand out to you that give you an indication one way or the other?
I'm gonna let Jeremiah take that one because I'm not a medical expert whatsoever.
Well, I think just going back to what I most commonly see, are some of the medical concerns, or the, hemorrhoids and fissures, of course. And, if this is happening, you're having pain or bleeding, that's not really a psychological thing. If you're having pain with a bowel movement, for example, that would be a good way to differentiate something's probably going on there, rather than if it was just with, anal sex. So I think for what I do when it comes to, cake issues, at least, most often what I'm dealing with is an actual medical issue. So it's a little bit hard to ascertain if it's something more, psychological.
Yeah, and I'm the opposite. We can, and you guys probably know this, Josh, you particularly, we can typically rule out medical concerns, just like Jeremiah was speaking of. So if we know that typically these are some things that are physical, we can obviously rule those things out. But when we talk about anxiety, when we talk about the nerves and the nervous system, all of that building up, we know specifically that is psychological and or mental.
Lamont, you want to add to that?
I have nothing to add.
Well, I think one thing I might add is one of the referrals that I make oftentimes is to a specialist called a pelvic floor specialist.
Yes.
And there's actually a really great one that runs a practice that works mostly with gay men in Atlanta. His name is Lance Frank. He has a couple of associates. He's really, really good. But all of the muscles that are basically and Jeremiah, help me get this right, kind of from the diaphragm down to the groin area. That's all what we might think of as the pelvic floor muscle set.
Yep.
And those govern everything from breathing to urination to defecation to ejaculation, and the tightness and loosening of the anal, the sphincter, all the muscles around the anus, etc. And sometimes, especially if there's been trauma, if somebody's experienced some sexual trauma at some point in their life, there's some muscle memory that kind of the body gets a bit sensitive around any kind of engagement in anal play. And so sometimes that results in an involuntary sort of tightening of those anal muscles. And a pelvic floor specialist can be, in addition to other medical providers, can be somebody that would help the body start to loosen up a little bit. And then there's a psychological component to that in terms of processing whatever trauma might be there or belief system that might be in place that is causing some of the issues. So that, I don't know if you all experienced that or not, or if that's been something that you all worked with before.
And Josh, I want to add something that you mentioned. You mentioned a lot of things that, happen when the pelvic floor is unfortunately had some type of trauma, sexual trauma or otherwise. It also regulates forms of pleasure. And I want that to be clear as well, because when you have your pelvic floor is actually working to its optimal level, it can be very pleasurable when your partner can massage it with the wand or massage it with his finger, so on and so forth. So I wanted to add that.
Yeah, for sure.
And I'll add to that as well. In my line of work, when I see patients who are experiencing symptoms from pelvic floor dysfunction, and that can be a range of symptoms from even like frequent urination, difficulties with ejaculation, dribbling, urinary hesitancy, anything that you can imagine with the urinary system can be related back to pelvic floor dysfunction. But in those patients, they typically are more higher stress, type A personalities. They hold a lot of their stress in their body. So that's some of the questioning when I'm talking to patients who are having those sort of symptoms, to sort of figure out, okay, what's your anxiety level? And they usually go hand in hand.
Yeah, absolutely.
Yeah, it sounds like a lot of anxiety. And I think, sex sometimes can be, I guess, it can be anxiety provoking for some. Some can be very enjoyable. It's all about like taking your time, taking a deep breath, trying to relax to make sure your body is comfortable and not trying to rush into things.
Yeah. And there was a point, Jeremiah, I think that you made in our last conversation where we were talking about sort of eggplant and erectile dysfunction, and that something that you said that I think is really, really important is that all it takes is one bad experience to kind of set in motion a thought pattern or a thought or narrative about sex itself. And I think the same can be true in terms of anal pleasure as well, that when I build up, if that's something I really desire, but my body's just not cooperating, or I'm trying to force it in some kind of way, or I'm doing it in the company of somebody that I don't really know, so I'm not able to fully relax in that situation, whatever the case may be, we want to examine sort of what the source of that anxiety is and what that narrative is around that,
If I could count, how many times people have said, I'm only a top because, right? I've tried it a few times and it hurts, and I really want to just encourage them to explore that a little bit more, because for many of us, I think probably the first few times were, you were younger, you probably didn't have much experience. Probably those first few experiences were painful. So until you can, learn what makes you, feel more comfortable, I think so many people just shut it off, Yeah.
And let's be honest, that's a really good point, Jeremiah. Let's be honest, guys. More than likely, we didn't have anyone to show us how to be prepared,
right?
And have those conversations surrounding how to be prepared, how to be an engaging for it to be an engaging and pleasurable sexual experience. Let's be honest. So when we're thinking about approaching this topic, the nerves are going to happen. It's bound to happen because we're probably ill-informed. And our bodies, recognize that we're ill-informed. Let's be honest.
How did you all learn how to prepare to bottom? Like, who taught you all how to prepare?
I was actually just having this conversation the other day. It's a little embarrassing. I don't remember preparing in my 20s. I don't think I knew what douching was. I don't know when I learned that.
Same here. I guess, but just Russian roulette. This is what this is gonna happen. And when you're in your 20s, I guess you're regular till you're good. Yes. Yeah. Until my friends were like, no, wait a minute. There's a whole regimen to get ready. Like it's like hocus pocus magic now. Like, yeah.
Well, in the Jeremiah, the comment that I think you made, or that you had heard some of your patients make in terms of, I only talk because thus and so, I think that applies to this also. That I certainly don't want to get into an embarrassing situation, or if it's somebody I really like, I want to, leave a good impression, and so just walling off certain areas of sexual, sort of pleasure. True. So I don't get into an embarrassing situation. I think one of the first times similar to you all, I mean, I mostly have topped because, at least for that period of my life, I didn't really I just hadn't taken the time to really explore, because that's really what it takes, is that you have to kind of get to know, like, give it a name, sort of talk to it as if it's another person, sort of make friends with it, become familiar, and I think in one of the Patrick Ian Polk movies, I think it was which one was it? The Skinny, I think maybe. There was a whole scene in that movie where he goes through this sort of thing, and I was like, oh yeah, that makes, kind of adding to the knowledge that I already had. So that was actually some really good education that he threw into that movie.
Yeah, and I want to say this. I want to add to what you just said, Josh. A very good point. Exploration, or as my high school crush, Janet Jackson. Yes, I did have a crush on Janet Jackson. She says sexploration, but realistically, for us, exploration or sexploration does not need an audience. And let me explain what I mean by that. We don't necessarily need to have someone to help us to explore our own erogenous zones, our pleasure zones. The anus, most of you guys know this, the anus has over 1,000 nerve endings, over 1,000. So keep in mind that it is a very pleasurable spot for a lot of people. And so when you are trying to figure out what you like, you can do it on your own and be gentle with yourself and take your time to explore what it is that you actually like.
We had a comment. Ben says, my issue is that it takes too long, I guess, to get ready. How long should it take to prepare to make sure you're, squeaky clean? Mm-hmm. What do you all think?
I think that depends on every person. I mean, and also situational. How many times have you done it and you're like 5 minutes and you're like, I'm good to go. And then there's other times where you're just like, it's not going to happen today. And I think it's just there's certainly things you can do, taking fiber supplements, and you don't need Pure for men. You can take one off of Amazon or your local drugstore. That's definitely going to help you to, douche more easily. And also knowing how much water to insert into the rectum, because, you have the rectum is only, 6 to 8 inches. And then you have what we call the curve, or the rectosigmoid junction. So if you get past the curve, you're in trouble. So, because water is going to sit in that and it's going to come out when you don't want it to. So I think when you're douching, you have to really be careful and experiment with how much water you need and practice. You have to figure out what works for you. Mm-hmm. That's probably my best advice for that.
Mm-hmm. Yeah. And I'll just add, diet also. I think that whether it's taking fiber supplements or eating, and then also timing, I think, your meal, if you anticipate, getting into some pleasure a little bit later and you want to be the receptive partner, maybe timing, maybe you don't do it after a big Italian meal, maybe, we kind of be a little bit more mindful about, the whole process. I see a question here in terms of, is there a way to always stay ready?
It's probably not healthy to always stay ready.
Eat people.
Yeah.
I think it's unrealistic to expect a guy who likes to bottom to be always ready. Like, it's not a vagina. Like, it's, it has a bodily function that's supposed to remove waste, and you're human, right? You have to remove waste sometimes once a day or twice a day. So I think it's unrealistic to make yourself always be ready.
Yeah, good point.
And I still think that there are ways to preserve an element of spontaneity and still, be ready. That, for example, if you know that you're going to be going on a hot date a little bit later, or you've got some hookup lined up, or you might be going out to the club or something like that and hoping to meet somebody. That there are ways that you just kind of plan a little bit ahead so that when that moment comes that you hope for, you are ready. But that involves a bit of preparation and forethought.
There's another question on Instagram. It says, would a bidet clean just as much as a douche with enough water?
No.
I was like, no. I'll let you elaborate.
No, you need a little bit more water. I mean, a bidet's not even going to really, in my experience, put water inside your rectum. You need some water inside the rectal canal to be able to, defecate out what's in the cavity there. And sometimes I talk to a lot of people. I get advice from patients even on what they do that works for them. And I've had patients tell me that they'll often go through a process where they douche and they give it about 30 minutes or so and they do it again. If they have that kind of time, and that allows them to just feel more comfortable that their actual douching process was successful. The more comfortable you can be with your body, and I think you're going to have a better experience with your partner.
Someone said, what's the best thing to eat beforehand? They said they normally just starve the day before.
So I'll comment on that. So, you have to know everyone has a different sort of timing from the time of eating to the time you're going to have a bowel movement, honestly. But, when you're eating, when you're ingesting more food, it's sort of signaling to your body to exit some of the food to make, room for what you're ingesting. And that differs from everyone. That could be for some people 20, 30 minutes up to an hour, 2 hours, 3 hours. I think the biggest message I would give for that is, if you're going to be, having anal receptive intercourse, you want to eat lighter. You want to eat probably just, less greasy foods. If dairy upsets your stomach, know what your triggers are, right? And avoid those foods. But I would just say overall, just eating lighter. You don't need to starve yourself, but finding a good time before maybe to cut off so you don't activate that process.
Yeah, someone was saying they take Imodium. It kind of helps them to slow things down.
Mm-hmm. Yeah.
Oh, there's another question. What is anal creaming, and is that a good thing? Have you ever heard of someone say, "Oh, he creamed on my eggplant"?
Mm-hmm.
Have you heard of that before?
Yeah.
Yes. Yeah. What is that? What is the anal creaming?
So the anus can and often does. I'm trying to be politically correct because I know they're gonna kick us off if I say something that's not correct. The anus can have an orgasm as well, just like we can from the eggplant. And when that happens, oftentimes you will experience some form of creaming. And it's not a bad thing.
It's normal. But if unless it's like a color, like I think there might be something going on. Like if there's like if you have gonorrhea or chlamydia in the rectum, then sometimes that's going to come out a certain color.
Mm-hmm.
Right. Probably more yellow or green, but
right.
Also if the person, the top is, pre-ejaculating, there could be some of that with the lube mixture, with just the inflammation, that can create sort of that creaming.
Yeah, looks like cream. I mean, let's be honest. We're talking using food analogies here. Yeah, I mean, I think it's a combination because the anus does have some lubrication naturally in it, and there's a lot of biological diversity in terms of how much one person's anus lubricates as opposed to other. I mean, they're just like all bodies are different. And so that in combination, and we hope that you are using a lot of lube. That is a great idea when it comes to receptive anal sex. That the combination between sort of the natural lubrication and whatever lube and any ejaculate that goes along with the experience, I mean, that all kind of produces this thing that looks like cream, and it's the natural part of the experience. We have any other questions, or we were moving on?
We can move on. That's all I got for you.
All right. Yeah. So what recommendations or even personal preferences would you offer for enhanced cake pleasure? Lamont, you go first.
Enhanced cake pleasure. I'm a big advocate of finding the right type of lube, right? Like there's some people who swear by gun oil or swear by Vaseline, or they like you have to figure out what type of lube. Do you like water-based? Do you like silicone-based? Do you like oil-based? And I think it is okay to have a lot of lubrication down there, because if not, there's a lot of friction. And you want your body to be comfortable. You want to enjoy it. And if it gets dry down there, that's when you start to get all the tearing, and it just becomes just not enjoyable whatsoever. So take your time, get some lube, and enjoy. You can change the sheets later. It's okay if they get messed up. Put a towel down. You'll be okay. Everybody has a towel they put down before.
Well, and I would just add, I think that's a good point, Lamont, in terms of reducing anxiety. If you're sitting there trying to be a receptive partner and you're worried about messing up the sheets, or you're worried about what kind of, if I've douched enough, or if, whatever, that's piling onto the anxiety, which can result in the tightening of those muscles. And what we want to do is feel relaxed and breathe and be able to be receptive to the moment. And so we want to minimize those points of anxiety.
Yeah. Someone said Vaseline is not lube. Do you all agree?
Petroleum has an adverse effect, so no, it's not lube.
Say it again, people. When you go over to Date's house, he pulls out the Vaseline. I'm always an advocate of bring your own. If you're going to go hook up at somebody's house, you should bring your own products that work well for you, so that way you're not left to just using the Vaseline or the lotion or whatever's close by.
Right. Let us not forget about the prostate as well, and prostate stimulation. I mean, that the prostate, of course, is the little sort of walnut-sized gland that's of 2-3 inches up and inside the. If you stick a finger or two up in the anus and kind of press forward towards the front of your body. You can feel it. It's like a little walnut size organ. And that is involved in, some might consider it. I guess there's, again, a lot of biological diversity in terms of the pleasure and how it's stimulated, or, in which spot, the G spot, if you will. And so, again, opportunity for self-exploration to kind of get a sense with your own body, with either using fingers, with using a toy, a dildo, a vibrator of some kind. And of course, an eggplant, to experience the variety of different sensations that you can experience with that. The prostate is involved in ejaculation as well, so it's got a lot of nerve endings in and around it as well.
Yeah, I think some guys totally forget about, some tops forget about the prostate, and they aim way past it instead of actually using their eggplant to find the prostate and try to massage the prostate with their eggplant. If that's how you want a bottom to enjoy sex, just go in a little bit and just stay right there and massage the prostate with your eggplant. The guy will love you for it.
Finding the right position to really maximize that impact, I think, is key. Because if you're just doing also the shape and the size of the eggplant has a big role in that. So if you have a curve at the end, that might be actually more pleasurable for someone when it comes to prostate stimulation. But what I was going to add to this was, and I agree with everything you guys say, and this is not something I've learned in a textbook, but just when it comes to rimming, I think there's so much focus just put on the anus itself, the hole. And there's so many nerve endings in so many other places on the peach that you can explore, up and down and around and all the way down to the perineum. There's a lot of nerves. So my advice would be explore the whole area. Those have been the best experiences personally.
Yeah, definitely.
I agree.
Any other thoughts about pleasure enhancement? And I would also just advocate for, well, I would encourage folks to advocate for their own pleasure. You know, you know, in some regards, everybody's responsible for their own good time. You know, that in sex, that we can't be mind readers. I think some people are better at others than intuiting, or maybe through experience, especially if you have a shared sort of history with a particular partner, you can build that narrative together. But if you're having sex with somebody for the first time, don't be afraid to say, hey, can we switch to this position, or here, let me try it this way, or I want you to do this to me, or, you know, like, and make it as sexy as you want, but verbal, you know, communicating through words, and of course body language, and maybe even guiding the person where you want them to be. All of that enhances pleasure, because it's useful information for the other person to have, to know what it is that you want, and to advocate for the ways that we want to experience pleasure.
Is this dirty talk? Is that what you're saying, Josh? Dirty talk?
Dirty talk, yes.
Oh my gosh.
All that.
Yeah. I don't. Can we say the M word? I want to make sure that Can we say that word? The M word?
Ninja?
No. M.
Oh, you mean play?
Pleasure. Self-pleasure.
Self-pleasure. We'll say self-pleasure.
Okay. And I think Josh and Jeremiah alluded to this. It's so important for you to self-pleasure, so much so that you begin to recognize what you actually like. That way, as Josh mentioned, you can communicate to someone else what you like, how you like it, where you like it, so on and so forth.
Mm-hmm.
Someone said, don't forget about the taint.
That's apparent.
Yeah. Oh, there was another question that said, are you knowledgeable about any urologists that work in Atlanta for prostate care and health?
I don't know of any gay ones myself. Jeremiah, you may know somebody, but I do know there are many that are gay friendly. That some have more competence than others in terms of having worked with the LGBTQ community. I'm happy to forward that information if you reach out to me.
Same.
Mm-hmm. Yeah. All right. So our next, and of course, you know, Lamont, let me know as the questions come in. Another question that I wanted for us to maybe take some time to sit with is, what misinformation about peaches do we want to clear up right now in this conversation? What comes to mind in terms of misinformation that you encounter a lot, or have either personally or professionally?
I hear all the time, like through my dating coaching, like some guys might be self-conscious about whether if their anus is too loose or too tight, or it just runs the gambit. And I'm like, different guys like different things. Like some people like as my husband says, a gently used hole, right? They enjoy that. Others, they might like something has a little bit more grip or has less grip. It just depends on your partner. So I think you should embrace whatever type of hole that you have, because I'm sure there's someone who will enjoy it.
Yep. What other misinformation that you all encounter?
This is more of I don't know necessarily if it relates necessarily to the peach itself. However, the submissive partner is more feminine because that person is the submissive partner. That is a huge misconception.
Mm-hmm. Yeah, and that kind of gets to one of the questions that and I think that's really important to examine the masculinity, femininity sort of spectrum around, you know, receptive or insertive anal sex. I mean, I think that's an important thing for us to address. I'd love to spend some time on that. Before we get to that, let's see, and we'll come back to that question in just a second. One thing that I guess I want to, again, having a theology background, the word sodomy comes straight out of the Bible. And there's, I think, quite a bit of misinformation about what that, you know, the origin of that and some of the biblical beliefs around that. I don't want to get too far into the weeds on that, but just that there is, I think, a lot of beliefs around anal sex, that, you know, if you see any protest at any kind of thing, there's, you know, these signs that, you know, that sort of, that, I mean, that's really kind of the thing that folks that might persecute gay men specifically, that's the thing that they think of when they think of us being sinful, or, you know, whatever it is. And I, you know, I want to just push back on that real clearly. And because I do think it is a source of shame for, you know, internalized homophobia that a lot of gay men, men who have sex with men, have had told to them, and have, you know, still internalized a little bit. And so we want to just be real clear that it is your body, and you get to have the kind of pleasure that you want to have, and full stop, because it's your body, you know, and obviously with consenting adults. I mean, I certainly want to name that as well, but it's your body. So
totally agree. And straight people have anal sex all the time. You know, like I'd say, I know a lot of female, you know, friends, they're having anal sex. But I also, when I noticed, like in our community, we talk about like the internalized homophobia. If a guy bottoms one time, we call him a bottom for the rest of his life, right? Like, and it's like, I think it still has to do with some of that self-shame. Like people say there are no real tops out there, because one man's top is another man's bottom. I'm like, can we stop putting people in these boxes and labeling them?
Yeah.
And people change too. You know, I think just throughout my life, and I have friends who have sort of evolved from a top to a bottom, or a bottom more into topping. And I think you can be in your top era for a while, and you can be in your bottom era. It's like, it's just doing what you want to do. And I think that's the liberty, and sort of taking back the power from all that shame. And, you know, I will tell, because I have patients who will say, oh no, I don't ever bottom. That's not for me. Like, you can tell instantly there is some shame there. And I will, you know, quit back, you know, some of the most masculine, hyper masculine men I know are bottoms.
Yeah.
Can we talk? I think we were starting to touch on this, and maybe this gets into some of the masculine, feminine stuff that I wanted to address. How do we help people better have better perceptions of peaches, cakes in relation to masculinity and femininity, which I think we're starting to kind of talk about a little bit. And then I want to address this concept of bottom shaming as well, because that's definitely something that comes up in the work that I do, and then just in you know, as I've been out and about and talked to, you know, folks out and about, you hear that rhetoric sometimes. I'd like to hear, you know, kind of what you all's experience with that has been, and how you think about that.
You know, Josh, it's deeply patriarchal. It's really, really patriarchal. It's really focused on and I'm talking about bottom shaming. It's really focused on the submissive partner being, quote unquote, weaker. And if that partner is considered weaker, then that's why, as tops, you would shame that particular partner. It's almost like, perfect example, it's almost like a stud, a man who's a quote unquote stud, or whatever you want to call him. He sleeps with a lot of women, and he is considered a stud. If a woman sleeps with a lot of men, then she's considered a whore. So it's that same principle, recognizing the shame in the receptive partner, but not in the penetrative partner.
So if a guy bottoms a whole bunch and has bottom for a lot of people, then we talk down on him. But if a guy is topped a lot, he's the man, then, right?
Absolutely.
But we call that street peen. You ever heard like he's like street penis? Like I think sometimes it goes both ways. When people will say like if you sleep around too much, but I think it has to still do with like our ideas of what sex is, and like if a person is supposed to be a virgin for the rest of their lives. Like that's an old way of thinking.
Yeah, and what does it mean to be sex positive within one's own experience? I mean, like you can be sex positive and have, you know, only had sex with one person your whole life. You know, it's about what is it that I find pleasurable? What are the values that I have in terms of how I want to order my own life? And that it not need to have anything to say about anybody else's pleasure or desire or behavior. You know, that we all get to and what does it look like for us to celebrate pleasure, even, to really celebrate that this person seems to be getting their life by as many different people or whatever it is. Like, amen, or what do I say, gay men instead of amen.
I think we have an idea too, just getting back to the masculine, feminine, but also dominant and submissive. We often think a top is more of a dominant role, but that I would also push back against that I certainly have ran into people in my life who are a dominant bottom or a passive top. I mean, I've seen both. So
I've heard the term bossy bottom. That's one of my favorites. Yes, I like a good bossy bottom. Yes, there's that question from before. Any thoughts or tips on aftercare if someone is bottoming? Jeremiah, we want to start us off on that one.
I have a very good friend who also works in medicine, and he shared with me one of his techniques is after, a pounding, he will take a small amount of just some over-the-counter preparation H and just sort of preventively, because, it's a steroid cream, so it's going to help with pain, swelling, inflammation. He just puts a little dab on the hole, and he says that works wonders. Something you could try. I also think it depends on personal preference, but if you immediately douche afterwards, you probably reduce. I'm not quoting a study on this, but there's probably some thought there that you would reduce the risk of STI infection as well.
Yep.
There was another one. Someone said fisting, rimming, double penetration, hygiene, scatter, all thoughts. Like, what are they're all alternative ways of pleasure?
Good question.
What's the question?
Well, there's not a question. They just wanted to just put it out in the atmosphere, I think.
Well, I mean, so, and can you put that question back up just so I want to make sure? I mean, one of the things that I think that I've kind of learned just as I've kind of crossed over the threshold into a certain age bracket that needs to get a colonoscopy every so many years is that the anus has some tremendous elasticity. Mm-hmm. And so when somebody's getting a procedure done of some kind and they're under anesthesia, the anus can be expanded to where the physician can fit their entire hand to do whatever the procedure is. That's for anybody. Now, for those who enjoy, double penetration, fisting, some of the things that would involve, the expansion of the anus and the rectal cavity, I guess. I mean that there's a whole culture of folks that really enjoy that experience. The experience of being filled in a really powerful way, or the experience of somebody. If I'm the person that is doing the fisting or inserting, that person has really submitted in a way, and there's something really powerful about that power exchange, especially if somebody is trusting you enough to allow that, or you're trusting somebody enough to allow. There's a certain intimacy, I think, that folks describe about an experience like that. And just all the things that were named. I mean, they're all part of the sexual menu, and we what do they say? We don't want to yuck somebody else's yum. Maybe somebody isn't into scat play. That's fine. Let's not shame other people about it. Jeremiah, did you have something you wanted to add to that?
No, I agree. I think alternative is really just a subjective term. When I hear those items listed, I don't necessarily think alternative. I just think, well, not everyone's into those things, but not everyone's into even having penetrative sex. So I think it's just the beautiful thing about being in our community and being sex positive is you can create whatever you want as long as it's consensual and legal, and as long as you fall within those bounds. I'm personally never going to judge you for whatever you do, and I think bringing that sort of energy forward, that if that makes you happy, if that brings you pleasure, then it doesn't necessarily need to be labeled as alternative. It's just normal for you.
Mm-hmm. Yeah, absolutely.
There's a statement like if a guy bottoms, he's at higher risk for contracting STIs.
Yeah.
Yes, he is, and also at a higher risk of HIV contraction. different studies put the risk as anywhere from 10 to 20 or 30 times higher. But also I want to be very clear when I say that there are people out there who think tops cannot get HIV. And that's simply not true. They can, it happens. There is just more of a risk when it comes to STI or HIV transmission for the peach partner.
And the reason why, I think Jeremiah probably could echo this, there's so many more blood vessels in the anus. And so, as we all know, HIV is transmitted through blood.
Sure.
Or
breast milk, yeah. Well, and it's just the tissue is just more fragile on the inside of the anus. I mean, it's just more fragile. It's more susceptible to tearing. I mean, that's, so we just want to be gentle. And I'm a big proponent for PrEP. PrEP is very accessible here in Atlanta through Positive Impact, Aid Atlanta, other, and I know Jeremiah, you prescribe that on a frequent basis. It is available, and there are ways to get it covered in terms of payment. So that we don't want to let cost ever be the one reason that we don't even bother investigating that, because it is one pill a day. And actually Emory and some others have done some pretty powerful research and production of I think there's going to be a shot that you can get, an injection that will cover your PrEP. You'll be covered for 3 to 6 months, I believe, Jeremiah?
It's actually every 2 months right now. They are doing studies. It's called Apretude. It's also part of a treatment plan for injectable HIV medication as well. And just to kind of echo what you're saying there, in addition to PrEP, we also want to just drive home the message that U equals U, undetectable means untransmittable. So just as important it is getting our HIV negative friends and patients on PrEP, it's also know your status. If you have HIV, there are programs out there, free clinics. There's no reason really for most people not to be on HIV medication and be undetectable.
Yeah, absolutely.
Because we want you to live a long, prosperous life, because the gifts that you bring to the community cannot be offered by anybody else, just you. And so we need you here. And that was one of the tragedies, I think, of certainly the AIDS pandemic in the 80s and 90s, before some of the medication became available, is that so many beautiful people died well before their time. And we were really all robbed of their presence, their gifts, everything. Yeah. Gosh, this conversation has flown by. Let's see. We got a couple other questions I want to sort of just entertain here for a moment. What is it about peaches that are so interesting? That was a fun question from last time. Lamont, why don't you start us off with that one?
I think they come in different shapes, sizes, colors, different smells. Some are smooth, some are hairy, and I think you should try them all. Until you figure out what you like. Okay, I think you can be like a kid at the candy store.
All you can eat cake buffet.
I think as you start to sexually explore more, you might find a different peach more enjoyable than the others, and sometimes it just changes over your lifespan.
Others?
I find it so interesting that it literally can start as this, very tight or, tighter orifice, right? That with pleasure, with intimacy, with lubrication and eggplant, it can really sort of morph into this more dynamic whole that is just, it's able to do more, I think. So from just watching it change with that stimulation, I think it's just, for me, a very interesting thing to watch.
And I may be unpopular in saying this, but I really believe this. I think that the peach has healing properties. And if you find, if you find a good peach or good peaches, plural, that's okay too. I believe that you can be transformed.
Mm-hmm.
Amen, brother.
Amen.
Amen. Amen.
One thing I was going to mention earlier, I wanted to introduce it to the conversation, was Well, two things really. There's a great doctor that you should follow on Instagram. His name is Dr. Carlton, DoctorCarlton, Dr. Carlton, and he is a colorectal specialist out in San Diego. But he has so much good information on his Instagram page. It's so easy to look through. He has demonstrations of douching. He has information about STIs, all these questions that I'm seeing pop up. His page is such a great resource. And the other thing I want to mention, he has a technique that he talks about called the butt clock technique. And so essentially, your external anus is a skeletal muscle and it's voluntary. You can open it up with your thoughts really. And then the internal sphincter is smooth muscle. So that is a little bit more of an involuntary muscle that you have to sort of work into. And so one of his techniques is he actually will guide the person to insert their finger just slightly into the anus, maybe an inch or two to the internal sphincter, and you press on each side of it at the 3 o'clock position for about 15 seconds, 30 seconds, take some deep breaths. At the 12 o'clock or the top of the muscle, the 6 o'clock, and then the 12 o'clock as well. So you kind of work on each side of the anus until that smooth muscle has sort of relaxed. And that really is a good technique that you could try if you do experience more problems with loosening up.
Mm-hmm.
Okay, Jeremiah, you better teach them how to relax and open up.
Not my technique, but I did want to bring it up.
Yeah.
News you can use for sure. Let's see.
Josh, there was a question that said, are whole serums, exfoliation, laser therapies, are they recommended for a smooth landscape?
Maybe. I think it's a personal preference. I don't see any reason if that's something that really, bothers you and you want, a smoother appearing peach. I think that's completely up to you. You can do it in a safe way, and you want to make sure that you've vetted any person who's going to be doing any type of procedure, cosmetic or not. But I do think if that's something that would make you feel more comfortable in your body, go for it.
Yeah. Good.
Well, any closing thoughts? I mean, this has been another really great conversation. We had some great questions. I appreciate all those who have stuck with us and those who might view a little bit later. We'll repost this in our various feeds for folks to watch later. And we'd love to hear, if there's topics that maybe you would like to hear more from this particular group discuss, questions that you have. We would love to return and continue the conversation, because I love these guys. They just have so much humor and intellect and wisdom and just a very positive attitude about us. And so I really appreciate that. We don't have enough spaces where we talk about this kind of thing in a celebratory manner. And so I really appreciate Jeremiah, Aaron, Lamont for offering yourselves up for this conversation. And I hope we can keep the conversation going. Any closing thoughts that anybody has?
I'll just say some people go to the gym to make sure they get a six-pack or have big muscles. I think taking care of your peach, your whole, it's definitely important. You have to embrace it. You only get one. So you should take care of it throughout your journey of life. And don't be afraid to have the conversation with your doctor or your friends so that you can talk about, your sexual health and your whole.
Anybody else? All right, guys. Well, thank you so much. Lamont, thank you for running the tech for us. We'll more to come. And again, share your comments, share your thoughts with us. And we really appreciate you being with us tonight.
Thank you all so much. Have a good night.
Good night.
Good night.